Live, Governor Bill
Lee's
daily briefing. Let's listen in to the latest on the coronavirus crisis here in Tennessee.
The impact that it's having on this nation and on Tennessee, but our strong efforts to combat that. And we are making strong efforts all across the state. We want to talk about those today. The more information that you have that's available to Tennesseans, the more you can engage, because we're all in this together. And together, we will overcome the challenges that are before us. Today, I'm going to talk about three primary topics, but include some others. I want to revisit the Safer at Home order that was made yesterday, this very important decision to create an environment for a greater level of safety in our state. I also want to talk today about the collateral damage of COVID-19, one of those components being mental health in our state and what we're doing to address the rising level of mental health needs as this crisis rises as well. We'll provide a brief update regarding personal protective equipment, medical supplies, healthcare capacity, those things that our Unified Command are focused on, and our members of our Unified Command are here today, as well as Marie Williams, our Commissioner of Mental Health, Danielle Barnes, our Commissioner of Human Services, who will talk with us as well about child care and the specifics of how we're dealing with child care in this state. Those questions came up yesterday, and we will be answering some of the questions as well that you presented yesterday. So that's the overview of what we'll be doing. We'll have a full slate. I'll get started. Today in our state, we have 2,239 confirmed cases of COVID-19. We have had 23 deaths in Tennessee. We've lost 23 Tennesseans as a result of this, which highlights the seriousness of our efforts and how important what we do is. We have conducted 27,000 tests in our state, and that's a strong number per capita for our state. So I'm proud of that. We'll be talking about some of the numbers going forward. Testing is one of the most important ways that we can attack this COVID-19 epidemic. I want to talk just a minute about the statewide Safer at Home order that will go into effect tonight. Yesterday, I announced that order. It restricts businesses that cannot possibly operate safely in our state in the midst of a COVID-19 environment. Businesses like barbershops, salons, recreational and entertainment outfits. The order at the same time provides for the continuation of essential businesses throughout every county in Tennessee. And it urges Tennesseans to stay home while providing less reason for them to leave their home. I want to again speak to the Tennesseans who have the privilege and the capacity to safely stay home for the next 2 weeks. We need you to do that. We need you to heed this call for you to stay home for 2 weeks. Lives are depending on it. Livelihoods are depending on it. Our healthcare workers' lives, the elderly's lives, the lives of your neighbors in Tennessee are dependent upon your efforts to change your behavior, like we all are, to stay apart, to stay safe, and to save lives in Tennessee. Your habits and your routines will make a difference as we work to swiftly defeat COVID-19. I talked about how I said your habits like shopping online with Tennessee businesses, or getting your food through takeout, or when you do go to the grocery, a habit of not hoarding supplies so that you don't bring instability to the food supply chain that is stable and strong in this state. Habits like communicating with people in a different way, but recognizing that people need to be connected with. Some that will be isolated over this 2-week period of time, especially the elderly, who are particularly isolated as they make an effort to keep themselves away from the rest of the population. So your efforts and your habits and your willingness to engage will change the speed with which we attack and overcome this challenge in our state. I want to say a few words to small business owners as well. This was one of the most difficult decisions that I've made because it affects small business owners in all parts of this state. And let me just say to you, small business owners, you are bearing the brunt of the decision to provide a safer at home order because we're making a decision to close down many of your businesses that will keep people in their homes in a greater way. I want you to know that I hear you. I feel that you have particularly borne the burden of what we are going through in this state. And I also want to commit something to you. As a former small business owner, a small business owner now that formerly worked in that arena, the idea that my business would have to be shut down is a very painful one, and you're in a very painful spot. But I want to commit something to you. There are resources that are going to be available. There are efforts that are going to be made. We will do everything we can to help you get back on your feet, get your business back in order, and recover when the storm clouds clear of this COVID-19. There are many that will bear the brunt, but small business owners in particular will as we go through the next few weeks. And I appreciate and thank you for your willingness to do so and to provide less opportunity for Tennesseans to get out of their homes. Now, I want to talk a little bit about the tremendous collateral damage of mental health and well-being. Last Friday, I was stunned to learn that we had 8 suicides in Knox County in one day. COVID-19 is a viral pandemic, but it is also a pandemic that can produce hopelessness in people when they're facing losing their jobs or losing their business or losing their health or losing their parent. It's an imminent threat to the lives and livelihoods of our neighbors, and my administration wants to be particularly committed to providing resources that provide a lifeline for Tennesseans who find themselves in a particularly challenged place with regard to mental health. For those who need professional behavioral health services, our state's behavioral health providers and our Department of Mental Health and Substance Abuse have been working closely together for weeks now in anticipation of what we knew was going to happen as this developed across the state and as it became a greater crisis for people, from a health crisis to an economic crisis that produces a mental health crisis as well. We've been expanding telehealth medicine, telehealth services. There have been daily conference calls to address needs, collaboration to procure PPE for frontline mental health workers. Yesterday, we received word that the Department of Health and Human Services federally has awarded us a grant to provide mobile behavioral health care units for rural counties throughout Tennessee. These mobile units will expand services that we provide through partnerships with nonprofits like Buffalo Valley and the Helen Ross McNabb Center. There is a 24/7 crisis line, 855 Crisis 1, mobile crisis for both adults and children and youth. We have crisis walk-in centers, crisis stabilization units, crisis respite. Tennessee's frontline crisis services system is well equipped to meet the needs of our citizens as they face the difficulties of COVID-19. For the Tennesseans that are uninsured and have no means to pay for mental health services, our 15 community behavioral health providers offer the behavioral health safety net. These vital services are available to everyone in all 95 counties. While we remain committed to fighting the COVID-19 pandemic, we're going to keep close eye on the collateral impacts like mental health. We need every Tennessean to be engaged. As you engage with those around you, be certain that you are also looking out not just for their physical well-being and their financial well-being and their emotional well-being, but you're looking out for their mental health well-being as well. And we want to be prepared to serve those Tennesseans that have those needs. I want to give an update on our efforts to secure personal protective equipment for Tennessee's healthcare workers. We've had multiple companies dozens of companies, along with our universities, who've made significant donations of personal protective equipment. These donations, in conjunction with the aggressive supply procurement process that we have through our unified command, it has enabled us to have medical supplies and personal protective equipment for every county in our state. We have either made a shipment to or arranged a shipment of personal protective equipment to each of our 95 counties all across Tennessee. It's been important that we not only have the right PPE here in our big cities and where the large hospitals are, but that we have PPE out to our first responders and our medical community in the rural counties as well. So we've made shipments or have made arrangements to make shipments to every county. We're working hard to stay ahead of that. We have folks here that can answer questions specifically about that as well. A lot of the PPE that we've been distributing have been coming from donations of companies. Also companies that have innovative and created ways to develop and to manufacture these pieces of protective equipment. If you are a company that wants to contribute, that wants to produce, that wants to give us your ideas around personal protective equipment and how we can increase that supply in our state, please connect. Join with our partnership that we have created with Launch Tennessee. We gave information on that before. I believe there'll be information available today, but if you connect with Launch Tennessee and you're a company that wants to help us in this arena of providing expansion to our services, we'd love to have your help. There was questions yesterday about the further release of data as we make a real attempt to provide as much transparency as possible to people in Tennessee around everything that is happening with COVID-19. We want you to have information. We think the more you know, the more you're able to help us engage in fighting this in your local community. So we will be releasing 3 new numbers in our daily reporting, negative results by county. We will be providing projected number of patients who have recovered from COVID-19, so it gives us a greater picture of who's actually still carrying the virus. And we will be providing deaths identified by county. Those 3 new additional pieces of information will be up and running by the end of the week, and Dr. Piercy can talk a little bit more about that. Yesterday, we had a number of questions regarding childcare and the safety of our children and how we are, when we closed schools, 1 million kids went back home, and that created childcare challenges for many across our state. That combined with the loss of income for many and all of the challenges that folks face has created a challenge around the way we take care of our kids in childcare. And so I've asked Department of Human Services Commissioner Danielle Barnes to join me and to make a few comments around childcare and the available funding around that and some of the steps that we're taking, and then we'll move on to questions. Danielle.
Thank you, Governor. One of the things that we know is that this is a very unique and unusual time in the state of Tennessee. We also know that there are a lot of families that are still out there that still need to work. There are people such as our first responders and all of those that are working to provide those essential services that the governor mentioned. We made the decision to leave our child care centers open at the discretion of every child care agency. We have relaxed our licensing evaluations during this time, but I want you all to rest assured that the department is continuing to provide technical assistance to these agencies during this time. The state is continuing to provide additional resources to these centers, such as grants for those centers who need additional resources to continue operating. That could be anything from supplies, cleaning supplies, additional salaries for their teachers, and the need that they need to have more people present to abide by the social distancing regulations. The department, at the request of the governor, has also created a registration process for those emergency temporary child care locations. We know that the health and safety of our children is most important. And by creating this registration process, it is a little different than our normal licensing process. It is indeed just a registration process. This allows us to know who is providing these services within the state. It allows us to work with these particular individuals on the appropriateness of caregivers. It gives us the opportunity to talk about ratios of child care providers to children, accountability procedures, as well as facility safety. We also, during that registration process, talk about CDC guidelines to make sure that those that are providing this temporary service know what they can do to protect the children. It is also important to note that we have conducted limited background checks on any individual who is providing service to these children. To date, we've conducted almost 300, and to let you all know that we have in fact denied one individual from operating a center because of a previous drug charge. These limited background checks include checks within the state of Tennessee. They include the Vulnerable Persons Registry, the DCS Child Abuse and Neglect Registry, as well as the Sex Offender Registry. One of the things we want parents to know for sure is we are going to be here as we continue to support you all as you all continue to provide these essential services for Tennesseans. Governor, I was also asked to provide a quick update on PTANF as well, because we do know that so many people have been impacted by loss of work as well as reduction of hours. And it is important for you all to know that our applications for the emergency cash assistance did go live on Thursday. This program provides cash assistance for families, including pregnant women. So individuals, unfortunately, are not eligible. It is designed to help those who have lost or suffered a significant reduction of hours due to COVID-19. And to be eligible, the applicants must have been employed by March 11th, and you can go online to our department's website to apply for those benefits. We do ask that you apply online. Do not come down to our offices. We are practicing social distancing. We are also publishing a toll-free number that is available on our website that if you want to check the application, the status of your application, that will be available to you as well. And once you submit your application, you will have between 10 and 15 days at which you will receive that actual card upon approval delivered directly to your home. And so we know that that will be a tremendous benefit to those individuals and those families who need that support during this time. Thank you, Governor.
Thank you. Thank you, Danielle. And I think what I want Tennesseans to know is whether it's unemployment or SNAP or TANF or SBA loans or any number of relief economically, whether it's mental health, physical health, emotional health, whether it is providing safety and security to your community around the spread of this virus, Tennesseans are committed to working together to serve and help Tennesseans. That's our effort. We are working hard to serve, and we're proud of the efforts that you all are making in your communities to make sure that when we do see the clouds part, that we will see a picture that we are proud of, that we have done all we can to mitigate the damages of this to the degree that we can. So we want to ask questions. I'll remind those who are calling in with questions that Commissioner Barnes, Department of Human Services, is here. Commissioner Williams for mental health and substance abuse. Dr. Piercy from any health questions you have. Major General Holmes is here with the Department of Military to talk about the role of that we are playing to put up temporary assessment sites across the state. Patrick Sheehan is here with TEMA to answer any questions about procurement, and we will be happy to start that question period.
Thank you, Governor. We'll go ahead and get started with questions. First, we'll go to Jonathan Mattice with the AP. Jonathan, your line is open.
Hey, Governor. I had a quick question about the nursing home facility in Gallatin. I was wondering if there have been any additional deaths confirmed there. I know that the overall number has gone up for the state. And also, have you folks made any progress in trying to figure out how that initially spread into the facility? Was it a vendor? Was it an employee? Or are there specific things that you're looking into along those lines?
I'm going to let Dr. Piercy answer that. Let me just say that it's a very difficult and tragic situation in that facility, and we are taking steps to try and prevent that type of situation in the future with regard to notification and our response to that notification. But I want to let Dr. Piercy specifically address your question.
Thank you, Governor. Thank you for the question, Jonathan. I have recently communicated with the administrator of that facility, and while we don't have death certificate data on all of these yet, she confirmed to me that they have had 3 of their residents unfortunately pass away related to COVID-19. Related to your question pertaining to contact tracing, that work is ongoing. That is a substantial amount of work given the number of positives there. Many of the people who need to be interviewed are currently hospitalized, and so that slows down that process. But please be assured that we are doing that to our utmost ability, and we'll get to the bottom of it. I also want to take this chance to remind you that sometimes people aren't at fault, and sometimes people are able to spread it unintentionally. And so depending on where it came from, I want to remind folks that sometimes this is just part of a disease process, and really is why it's so important to stay apart, because you might be able to transmit the disease before you even know you have it.
Thank you, Jonathan.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Hi, Governor. This is a newsroom question. Have you talked to Kentucky's governor about his criticism of Tennessee's COVID-19 response?
Yeah, I talk to governors almost every day in an attempt to work together. We governors share best practices. I would guess I've talked to 40 governors over the course of the last few weeks, and it's a great source of great resource to me and to one another. It's a great help to one another. I have not specifically talked to the governor from Kentucky.
Would you have anything, if I could follow up, to say to him about his criticism of Tennessee's response and urging Kentuckians not to who live along the border, don't go into Tennessee?
No,
Be careful if you do.
No, I think I'm really focused on Tennessee and how it is that we test aggressively here, that we address the issues that are most important to Tennesseans. Tennessee is very unique. It's very different from every other state. The challenges that we have are unique and different. I would be happy to offer any support or advice or help that we might be able to give him, but I'm focused on Tennessee.
Next, we'll go to Savannah Smith with WPIR. Savannah, your line is open.
Hello, Governor. So speaking off of the Safer at Home order, how can members of the public report non-essential businesses staying open in violation of the order? And, just what is the state doing to enforce the order?
So one of the things that's encouraging or that's interesting about this order is, we have had similar stay safer at home orders in our major metropolitan cities now for days and even weeks. And the response of Tennesseans has been powerful. The need for enforcement in those cities has been minimal, and most of that has been done by encouraging enforcement there. So I don't think we're going to have a strong group, a large number of Tennesseans who are not going to comply with this order. And we will be monitoring that. And if we find something different than that, then certainly we'll make decisions around enforcement. But in the places where this has been put in place in Tennessee, which was about half of our population prior to the order that I put in place yesterday, we've had a great deal of cooperation from Tennesseans all over the state.
Next, we'll go to Harriet Wallace with Fox 17. Harriet, your line is open.
Yes, thank you. First, Governor, I have 2 parts to my question. One, can you please respond to criticism from some who said that the state has been slow to respond to the need of the vulnerable folks who are in our nursing home, and we saw what happened in Gallatin. Secondly, can you expound some more on what you said earlier about proactive steps that you are taking to prevent that from happening again? Thank you.
I'll let Dr. Piercy talk a little bit about the steps proactively that we're taking, but our response to that, to the situation in that particular nursing home was within 24 hours, we started the evacuation of that nursing home, and we responded immediately to find out who, how many, to evacuate, to test every resident of that nursing home, and then to further evacuate every resident after that. So I would say the response of the state was swift and certain. We also have put in place, as a result of that, efforts to keep that from happening in other places. And I'll defer to Dr. Piercy for the detail around that.
Thank you, Governor. As we discussed yesterday, there have been significant steps taken for the nursing home population and other long-term care facilities. One of those steps is guidance that I put out late on Saturday night related to preparing your facility, preventing the entrance of the virus to the facility if at all possible, and then what to do if that happens. And one of the significant changes that we've made is made it immediately reportable when any staff member or patient becomes positive. That way we can start working with them proactively and not find out about it once it gets to be a bigger problem. Most people are doing that already, but sometimes we don't know what we don't know, and so we are now mandating that they report that to us. The other thing that we're doing that helped in the Gallatin situation and will help in future situations, because unfortunately there will be future situations, is that we have the ability to do mass testing. And so, as the governor has said many times, the more we know about who is positive, the better job we can do about protecting them and protecting those around them. So those are some of the major steps that we're taking.
Next question.
Next, we'll go to Sam with the Daily Memphian. Sam, your line is open.
Yes, so Governor, you said a minute ago that you'd been talking to other governors frequently. In Shelby County, of course, they're surrounded by Mississippi and Arkansas, and I don't believe they have even as strict guidelines as Tennessee does. Have you talked to the governors of those two states to see if they can increase their stay at home or shelter at home or whatever type of restrictions they could do?
Well, I've talked to both of those governors. As yesterday, was on a call with one of them, talked personally with other governor. It's kind of like the question about me and the governor from Kentucky. I want to offer help to those governors. I'm certainly not going to criticize them. So you asked earlier about Kentucky. We test our citizens 3 times more per capita than the state of Kentucky. I'm not criticizing that. I'm just saying we know a whole lot more about our population because we're testing so readily in this state. I would say to any governor, any state around, that if they would like to know how it is that we are doing such a great job with testing, we'd be happy to do that. But every state is unique. They have their own unique population. They have their own challenges. Every state's testing at different rates. Every state has a greater, we have bigger cities than any of those states that you've mentioned. Nashville's a bigger city. Memphis is a bigger city than those others. So we have dense populations that they don't have. Comparing states is not productive. Looking at best practices is productive, and we've talked about those.
We'll go to Joel Ebert from the Tennessean. Joel, your line is open.
Yeah, Governor, I just wanted to see if you could elaborate a little bit more on the U.S. Department of Health Human Services Mobile Behavioral Care Unit. A colleague is trying to work on that story, and so she's a little bit unclear what exactly that is, and how would people access these mobile units in a sort of moment of crisis, and why is it just in East and West and not Middle Tennessee?
I'm going to let Commissioner Williams talk to that. She can answer that question better than I can.
Thank you, Governor. Much appreciated. This grant went in as we were looking at the highest need for mobile services across this state about 3 months ago. We saw a higher need in West Tennessee as well as East Tennessee, focusing on rural counties. As the governor said, Buffalo Valley and Helen Ross McNabb are our community partner providers, and we cannot wait to start having people get hired through those two entities to serve people in our rural counties that are suffering at this time.
Okay, next we'll go to Phil
Thank you,
Williams from
Commissioner.
News Channel 5. Phil, your line is open.
Good afternoon, Governor. The latest projections are really staggering. You said yesterday that you had sought discernment in deciding when it was the right time to ask Tennesseans to stay at home, but the medical community has been pleading with you for more than 10 days now to do shelter in place. From where did you seek discernment if it wasn't the medical community, and are you concerned that lives may be lost because of the delay?
Yeah. You mentioned the medical community, and first thing I want to do is commend the medical community. We have doctors, nurses, and medical health care providers that are on the front lines and, quite frankly, are putting themselves at risk to serve Tennesseans. So as you mentioned, doctors and healthcare workers, I want to say from all Tennesseans, we thank you for that. And I have sought certainly input from healthcare specialists all over the country, not just here in Tennessee. I've spoken with epidemiologists and have talked with governors and their healthcare providers across the country. There certainly are medical providers that have opinions widely differing than the others, and there is a lack of real evidence around what decisions are actually producing results. As you know, the governor from New York said on Friday that he had come to the conclusion that maybe his statewide mandate was bad public health policy because of some of the ill effects that it had. So there are a lot of varying opinions, which is why discernment is such the right term there, because you get a lot of input that is quite varying across the board from medical providers across the country, and therefore taking all that into account, we tried to determine, and I said this all along, we tried to determine the right time to do this. You can't do it for an unlimited time period. So you have time periods that you can do it. The right time, when the curve is at the right place in Tennessee, will likely have the best impact to slowing the surge. And that's kind of what we're trying to do, is flatten the curve. And we think to the best of our ability, we've made the right decision.
Do you think you were too late and lives will be lost because of the delay?
I think we made the right decision on timing. I think that lives are going to be lost in this state. We've already lost 23. There will be many more. And in states that implemented these actions earlier, they've had significant loss of life. In states that haven't implemented it, they too have loss of life. There's very little evidence about exactly how and when these are most effective and working. We'll probably know in the aftermath as we can look at what the outcomes were, but it's a really hard decision. I will say this, I'm deeply concerned about the lives of every single Tennessean. And the decisions that we grapple with and that we wrestle with, the amount of information that we take in, the charts that we scour, the websites that we search, day in and day out, are all made in an effort to find the absolute best decision-making process and the right timing for our state to protect the citizens of this state in the best way possible.
This time we have time for one more question. We'll go to Kim Cruzi from the Associated Press. Kim, your line is open.
Hi, Governor. This question may be for you or maybe for Dr. Piercy. I was just hoping that you could kind of talk about what changed regarding the switch for releasing more data when it comes to county info on deaths.
I can specifically address that piece, and then you can add more. You know, we want to be as transparent as possible. We've had this conversation multiple times in the last few days. The more Tennesseans know, you know, data that's pertinent and that actually is helpful, the more we want to give it to them. The particular situation around deaths per county, you know, different states are authorized under HIPAA in different ways. There's a technicality around the legal implications of providing data. If you fall under a certain category of HIPAA requirements, and some states don't, we did. It required us to pursue a legal decision and path that was prohibited, for lack of a better term otherwise. That sounds like a complicated way, but what it really is that we pushed because we wanted to be able to provide that transparency, but there had to be some decisions made and some requests granted in order for us to be able to provide that. That's how that decision has changed, and the data will be made available Friday. You want to add to that?
Thank you, sir. Hi, Kim. The governor's right. The data is a very high source of interest, and we want to be as transparent as possible while giving accurate and appropriate information. And he mentioned the HIPAA status of our state health department as opposed to some others. That's one consideration. Another consideration that you will see skews our data a little bit, or at least colors it, is a lot of our data is reported by external entities. And so we're somewhat at their mercy, even though that reporting is mandated, we're somewhat at their mercy for them to give us timely and accurate information. So we do have 3 new data points that are either online today or will be later in the week. So as of today on our website, we are reporting negatives by county. And that data is almost complete. You'll see that there is some of the tests are still pending, but that helps us get a better denominator, and that is a proxy for access. So that allows us to know which counties are doing a good job at testing and which have some more opportunity. As the governor mentioned earlier, we are now reporting as of today on our website number of recovered cases. That helps us track over time how many people are recovered and how many people are still in active infection. You'll notice that that number is very low today. That's because our first case was only a little over 3 weeks ago. And finally, as he mentioned, by the end of the week, we will be able to report death by county. That was one of the HIPAA-covered issues that we had to work through, but that reporting will be by the end of this week.
That's all the time we have for questions at this time. Governor, if you'd like to make a closing statement.
Yeah. Again, I just want to thank you. Thank you for being here. Thanks for tuning in out there to listen. We do want to give you as much information as possible. We want to continue to share facts and information. We also want to share hope. We reminded everybody that there, as I said yesterday, there's a storm over our state, and the clouds are dark, and it is a difficult spot that we all find ourselves in. But we do know that storm is passing. It's moving. We are doing everything we can to protect Tennesseans as they stand under this storm, but we also know that the clouds will part and that we will get through this. And when we do, I believe that we will be proud of the way Tennesseans worked together and came together and did their part by staying apart. Thank you.
So you have been listening for the last 42 minutes to Governor Bill Lee and other state officials talking about today's developments, the latest developments on the spread of the coronavirus here in the mid-state. His main point today was focusing on the mental health. Yes, he reiterated our Safer at Home statewide initiative, but the mental health of workers and of all of you watching. It has been tough, as we all know, but in Knox County, for example,